medication, but that's already a symptom of Parkinson's. So again, it can be difficult to figure out, but if you started taking a medication because you were having joint stiffness, and then you start having head tremors, that might be a side effect of the medication. It might not be the Parkinson's itself. Sleep disturbances, again, a Parkinson's symptom and a side effect of the medication. And then swelling, which we call edema, can be another possible side effect. I'm going to go try to hit that button again. Hang on. It wouldn't be fun if there wasn't drama. Is it every Wednesday?
First Wednesday.
Oh. Oh. All right, hang tight, everybody.
You said about the swelling. Would that be any particular part of the body?
I would think that it wouldn't be overall. It would be a particular part, but not specifically, like it's only over the ankles. That is a quite popular place to have swelling, in the foot and ankle, up into the calf. Other things can cause swelling as well, though. So if you start to take a medicine and then you notice the edema, probably it's a side effect, but it can also be from your heart or from other things that are going on. If you have chronic back pain or neuropathy, things like that. It's good to know like your body as well as you can. All right, I hit the on button again. We'll see what happens. So the next thing we're going to start talking about, yeah, it's coming on, is the therapies that we want to encourage people to use. Parkinson's disease oftentimes starts slowly, symptoms that you can manage. How about that?
Win the lottery. Win the lottery today.
Okay. So there's obviously a lot of different therapies that can be used. We're going to be talking specifically about how physical, occupational, and speech therapies can be helpful. Treatment is going to focus on any of the symptoms you have. We would typically treat the symptoms of Parkinson's. We're not specifically typically treating the side effects of medication, because the medication's causing it, then therapy is oftentimes not going to help. So keep that in mind as well. So it's always important to seek out a professional. What's going to happen is you know somebody, or you are diagnosed with Parkinson's, and you start off with a tremor in your right hand. And you can pretty much do everything, but the tremor is annoying. Parkinson's is a progressive disease, so it's not going to stay like that. So as soon as you start having trouble playing cards with your friends, or writing out your bills, or whatever the case may be, it's nice to have somebody that you can go to. If you start therapy early, you oftentimes can do a few sessions, work on some exercises, stretches, or management, different ways to manage, perhaps if you're playing cards, how to hold the cards using a card holder. Lots of little techniques that can really help keep the symptoms at bay and to manage them before they get worse. The ability to move around and stay active, of course, is really important to the general well-being of your life. Physical therapy helps you keep moving as long as possible. We're talking about things like gait training. Do you use an assistive device? Do you need one? How do you pick up your feet? Where do you look when you're walking? How fast do you walk? Do you lose your balance? Do you sway? Things like that. Balance training. When you're standing still and trying to do something, if you lose focus of what you're doing, when you're dynamically moving and managing your balance. Sometimes that happens in standing. Sometimes those things need to happen sitting down. Regular exercises and general resistance training are, of course, also really beneficial. Other things that happen, though, in the daily life, like is taking care of yourself. We're talking about things like getting yourself out of bed in the morning, getting washed and dressed, preparing your favorite breakfast, or modifying what you do have for breakfast. Can you get the pills out of the pill bottle? Can you still brush your teeth? Occupational therapy is talking about these kind of things. There might be reasons why you don't need to just stop doing something. You don't need to just completely change how you do something. The occupational therapist oftentimes has a ton of really great ideas, small tools, changes to what you grip, how you grip, things like that can really help. And then the last thing I want to talk about specifically about that speech therapy is that research has shown that 89% of people with Parkinson's disease experience speech and voice disorders. 89% is almost everybody. That's 9 out of 10 people, right? So these are things that we talked about. A soft voice, that monotone without that inflection of your voice. Breathy and hoarse voice, uncertain articulation. Again, you're trying to say, I think I left my sweater at church, but those words aren't coming out. So the speech therapist is oftentimes very, very helpful for things like ease of participation in general conversation. So when you go to the bistro, you don't feel worried or you don't struggle so much to have that conversation with your neighbor. Confidence in general social settings, things like that. The speech therapist also can work on cognitive issues, right? So the speech issues themselves, the voice box, but the cognitive issues as well. So if you're having trouble remembering things, if you're having trouble keeping something organized, speech therapists oftentimes have exercises you can do, a lot of things that can happen there. It is nice for any of the disciplines of therapy to have what we call a baseline assessment. So maybe you were just diagnosed and you know you're having some trouble, but you're still completely independent. Knowing what your level is starting for physical therapy to check your balance and your gait, or the speech therapist to hear your voice and check your cognition can be helpful moving forward as well. This doesn't want to hold everything, does it? Okay. So this is just showing how we might break that up, right? Physical therapy, first column, we're talking about strength, balance, endurance, flexibility, and gross movement. So can you lift your arm up and take a step forward, like general gross movements? Endurance training, we're talking about being able to get on the new step for 10 minutes at a certain intensity. Or can you walk from your room, if you live in Oak Tree, down to the wellness suite, or are you having trouble doing that? Those endurance type tasks. Occupational therapy is that middle column. So those fine motor skills. Can you still button a button? Can you still toast your bread and butter it? Range of motion and flexibility again, but typically of the hand and arm. Maintaining your independence, getting in and out of bed, getting yourself ready in the morning, getting yourself ready at night, things like that. Problem-solving activities in the bathroom, in the kitchen, those kinds of activities, and general activities of daily living. And then that speech-language pathology, that's our speech therapist. We're talking about vocal strength and clarity, thinking and swallowing, right? Because we can always have trouble swallowing. That speech therapist is going to work on that as well. I'm trying to see if there's something I missed talking about. Oh, there's this 2-hour pain rule, which was just a study that was done, suggested now by the Arthritis Foundation. These rules are finding to be applied easily to Parkinson's and neurological patients also. So if you have pain for more than 2 hours after some sort of exercise you did, so you come to therapy, on Monday you feel fine, you come to therapy on Wednesday, and therapy's over at noon, pain starts at 2 and it's lasting for more than 2 hours, right? So if you have pain, stiffness, soreness, fatigue, but it's coming and going, that's not a big deal. If you have pain that's lasting at least 2 hours, then something was too vigorous. We did too much, or we did it for too long. You come back to therapy and we adjust what we're doing and how much we're doing. Just building up that tolerance. So that 2-hour pain rule is something interesting to note. We always want people to have good balance. That can happen with the physical therapy or the occupational therapy. Sometimes that's occurring more often during your normal routines in your room. Sometimes you're noticing that more when you're out in the community. So sometimes you can have difficulty moving in your own space. Maybe it's cluttered and crowded. Maybe the things you're thinking about and need to do, it's just too much to all process. That can happen. But at home, you know that if you left your chair there, that it's not going to suddenly be here. You know that if you're going to walk down the hall to your bathroom, no one's going to be there. When you come out into the community, even indoors, you're not sure when you turn around in the bistro if somebody's going to be walking by. You don't know if you open the bathroom door to come back out into the hall if somebody's going to be waiting. So that's what we call more of a dynamic, open environment. So you might notice that your balance is different in one situation than the other. Also things to pay attention to. We want you to have a really great quality of life with your Parkinson's disease, so it's important to understand that your experiencing of symptoms later in the course of the disease will help change the mobility that you have and the function that you have, and we're here for all of that. So we have those motor symptoms that we've been talking about, but there might be non-motor symptoms as well. The non-motor symptoms are things like apathy, the depression that we had talked about, constipation, those sleep disorders, your change in sense of smell, and their cognitive impairments. So again, all of these things combined are things that we're going to help you work on, right? Because if you have a balance problem, but you also have what we call apathy, where you don't care about it, you also have that blank face, perhaps, where you can't show emotion about it, that doesn't mean that those things are not important. We're going to work within all of those constraints. It's like a double bunch. Okay, so we're talking about things in Parkinson's, big and loud. You might have heard of that. That's a big thing that you can go get extra certification on as a therapist. The big and the loud. The big is usually physical and occupational therapy. The loud is more oftentimes speech therapy. You can be certified in all of it. You can just have some knowledge of it as well. Some of the neurologists want you to go to somebody who is certified in a big and loud program. Sometimes that's not necessary. So the big is making big motions. So instead of lifting your arm like this, you're really trying to go. And you might have to do 10 or 30 of an exercise. It might be swinging both arms up and down. There's several exercises in particular that are related to that big program. And it's going to reinforce normal movement. So you do 10 of these, and you do 10 of these, and again, I'm giving basic, blatant examples, not specific ones. And then that's supposed to then help you stand up from the chair easier and walk across the room easier in your normal activity. Large and loud noises, trying to really shout when you're speaking, having that high effort of speech, using those neck muscles in that voice box bigger and louder, will then reinforce normal voice volume when you're talking normally. And then other things that could happen are a floor ladder, which is where, you know, the floor is laid out where you won't trip, right? We're going to help you, but you have to step just slightly over something, right? So you have to kind of unnaturally pick your feet up instead of that shuffling that we see a lot. The metronome is a sound. It can be an app. I have seen walkers that are equipped with a metronome. So it can be set if you walk fast, right? It can be set slow, but every time you hear the click, you're supposed to be able to take a step. Like that. That's a metronome. I have also seen walkers that have a metronome attached to them that also have a light that will shine. So similar to the floor ladder, there's this red light shining, and you're trying to step to it. Every time you walk, you're trying to step to it to get you out of that shuffling pattern. And then lots of cueing. Of course, we're always providing cueing for people for lots of things that we want them to do. Supportive therapies outside of rehab. These are some that are offered here. These are some that can be offered in general. Massage and Tai Chi, I believe, are both offered here. I don't actually know if the Tai Chi is still offered here. Yoga, chair yoga is nice. Regular yoga, if you're into that. Meditation is a lovely adjunct where you can kind of get everything to perhaps calm down. Pet therapy is also nice. The Alexander technique is a specific technique that can be trained by, I think, laymen about postural control. So this man, Alexander, was from, I believe, the 1800s. He developed these general techniques where athletes, musical performers and dancers, people who gave speeches as like a living would work on exercises related to where their neck and shoulders are, related to what the ribs were doing, related to what the posture was doing. That's the Alexander technique. Again, Maybe some of these are important for you, maybe all of them are. For some people, maybe none of them. But if you're having a ton of stiffness in your muscles, massage might be really helpful, yoga might be really helpful. If you're having depression and apathy, meditation and pet therapy might be more important. It's always going to depend on what symptoms are bothering you. So our community has general well-being flow of, how things happen. So Cimbria has physical, speech, and occupational therapy in our rehab program. We also have the fitness center where Fran works as Cimbria employee as our wellness coordinator. So we might be going, and some of you might have done this or heard of people doing this, you might be going to Fran or going to the body shop for exercises 2 or 3 times a week, and then something's happening and that's not working. So you take a break there and you come to us. And then when we feel like you're at your baseline or you're at your best, we're gonna send you back to the well-being, back to the body shop. Back and forth, that might happen. You can do supervised exercise sessions in the body shop. You can do exercise on your own with the correct clearances. And then we have those Live Well, Learn Well series that most of the time Fran offers. So just kind of wrapping that all back up and connecting those two things. Rehab and Fran really like to work together so that we can capture everything that you might need. Somebody comes to us with a sore shoulder, right? This isn't really related to Parkinson's. We might tell the person not to go to the body shop. It's going to be better to rest it and only do what therapy wants them to do. And then when we're done with therapy, we might give them a home exercise program and suggest they go back to the body shop. Parkinson's would be very similar. We might give you some very specific exercises to do on your own 2 or 3 times a week, and then going back to the body shop might be a very important adjunct to that as well. So we talked about the medicines, we talked about the rehab, and we talked about aspects of the well-being, knowing that all of these things together really play a very important role in the overall well-being of somebody who has been diagnosed with Parkinson's. I'm happy to answer any questions you have. There are 2 papers. One is more of like a questionnaire to help you decide where you need to be with your Parkinson's. The other one is general information as well. So you can pick up more than one of those papers on the table there if you know other people who might benefit from that. But otherwise, are there any questions that anybody has based on what we talked about or other things that have come up that you've thought of? Thank you guys. Appreciate you coming. I'm going to shut this off. If we want to talk, we can.